And good afternoon from KCAU-9 News. I'm Tim Seaman. We're standing by for a live briefing from the Woodbury County officials and Siouxland District Health Department today, as Woodbury County now reporting more than 1,500 cases of COVID-19 and 7 deaths, all related to the virus. The Siouxland District Health Department just moments away from giving citizens an update on the situation. The director of Siouxland District Health, Kevin GRIEME, will be on hand today, as will the Deputy Director Tyler Brock. The CEO of the Siouxland Community Health Center, KAPTAIN-DAHLEN, will also be on hand today, as well as the president of the Siouxland Chamber of Commerce, Chris McGowan, is also there. Let's take a look if we can. We can see they're getting ready there for those folks to come to the head of the room for that briefing. This is the first briefing from Siouxland District Health in a couple of weeks now, and we plan to get an update on numbers as well as testing and no doubt a tie-in to the business community, as several businesses locally are now being allowed to open up under some type of parameters here inside of Woodbury County. Stand by for, again, Kevin GRIEME is the director, the Deputy Director Tyler Brock, and the Director Kevin GRIEME of Siouxland District Health Department, as they will be coming to the podium. Just today alone, 474 positive COVID cases released between Dakota County, Nebraska, and Woodbury County. It was 113 today here in Woodbury County, but between the two, 474 new positive cases. And I guess let's go ahead and listen in now over at Siouxland District Health.
The Operations Center and the Joint Information Center were activated back in March to track and prioritize resource requests and public information. Our operations are atypical, with only a very small physical presence in the Emergency Operations Center, and most tasks are being completed virtually. We are in routine communications with multiple agencies on all levels. Emergency management continues to provide guidance to local jurisdictions throughout Woodbury County and sharing key information to partners as well as the public. Weekly, emergency management receives resource requests for personal protective equipment to submit to the state to ensure our frontline workers have the proper protection to continue to care for people and provide essential services. At this time, I would like to turn it over to Siouxland District Health.
All right, thank you, Rebecca, for those words. Kevin GRIEME, Director here at Siouxland District Health Department. Over the past few weeks, we've been reporting information and data out to the residents of Siouxland. At this point in time, of course, a part of that is not the fun part of the job of actually reporting the deaths that have occurred. Just in this last week, we experienced 3 additional fatalities for a total of 7. And one of the things in this era and time is the fact that with this, those families don't truly get to celebrate the lives with the limitations we're seeing because of this disease. So our sympathies are extended to them, and we acknowledge that. And we do hope, and I think part of what we have to do as a community for our mental stability is to continue to look forward to say, what is it we can do to limit the impact overall? Within the state of Iowa also, in an ever-changing environment, we've made that a common sort of thing, is that we don't know, anticipate, we're learning as we're going. Some of our limitations have been reduced in the past week, come announced to us kind of unsurprised in doing that. So I think a part of, like, from here on out, we need to begin to share and continue to educate residents on what they can do to keep themselves safe and to play a role in limiting the exposure and the spread of this. Today I do have the opportunity. Joining me that I'll also be speaking is KAPTAIN-DAHLEN from the Siouxland Community Health Center, and as Rebecca mentioned, Chris McGowan from the Siouxland Chamber, and then Tyler Brock from Siouxland District Health Department. And I think to get us started on one of the positive things, when we talk about Siouxland, the work that we do and we respond, the partnerships and the cooperation that we do, our first initial effort, there's been much discussion related to the availability of testing. And I think when it's going on in your own neighborhood, you don't realize the progress and the accomplishments you're making. Just this week, Siouxland District Health Department compiled the testing data from the 20 most populous counties in Iowa. As of Monday, May 5th, Woodbury County ranks number 4 in COVID-19 testing rates, with 1 out of every 26 residents that have been tested. This is compared to the state that has a testing rate of 1 out of 52 residents. We don't do any of the testing directly. And I think when we look at this as far as the tests done, we also recognize the aspect that this is numbers reported by our local provider network. Siouxland Community Health Center has led the effort. Unity Point St. Luke's, Mercy One Clinics, Family Health Care of Siouxland, Prairie Pediatrics, and the Siouxland Medical Education Foundation. It is truly through their combined efforts that this service has been offered, and we were actually one of the first drive-through clinics that was up and running within the state of Iowa. And I commend this group for the coordination and the planning that they did to do this. The numbers that we have provided in the table, and we will distribute this out to the media, are representing the testing that was done prior to any external or targeted testing. So the Test Iowa initiative going on now, those numbers are not included. Some of the testing done over the weekend through one of our major retail or plant packing places, those are not included. These are the tests that have gone through our healthcare process. And so we really look at that as kind of an accomplishment, and we have to give kudos out to those individuals. So what we want to do in closing is really to make sure that you understand, although it's been questioning about the amount of testing, and we've always said we need to increase it, we have to recognize the volume and the quantity of testing that has been occurring in Woodbury County. And I think it's important that we continue these efforts because we will see our numbers grow, but we need to get those positive cases identified. Then that gives us an opportunity to work with them to limit some of the impact that might have in the spread. So no further information on that at this point in time, but I will turn it over to Mary KAPTAIN-DAHLEN, and she's kind of the spearheader of some of the testing and can share some of the information of what Community Health Center is doing to support Siouxland.
Thank you, Kevin. I am Mary KAPTAIN-DAHLEN, the CEO at Siouxland Community Health Center. As you all know, testing has been an imperative through the COVID pandemic, recognizing that it's very important that we are able to detect people that are positive for the virus, to be able to isolate them, and then also do contact tracing. So we have very early on worked as a community health center in partnership with our federal bureau as well as our state officials to say, how can we serve as a testing site for this community? We knew that we couldn't do this alone. That this needed to be a community partnership, and as Kevin emphasized, we have done that in cooperation with the District Health Department, with family health care, with the residency program, and also many other private and specialty practices in the community. We have made a very concerted effort to not only test, but also to educate people who are coming through testing. It's one thing to test, but if people are not educated on what they need to do following the test, how they need to do self-care and also care of their family members, how to respond to symptoms that may become exacerbated. All of that is very important in understanding and containing this disease. So we have worked very hard with providers across this community to make sure that there is an educational platform in place along with testing, and that when the results are given to an individual, a provider is following up with all positive patients to make sure that they understand what the next steps need to be for them, and also if they are negative, the precautions that they need to continue to take. I am very pleased to report that since we started our testing site on March 27th, we have screened over 4,900 people for COVID. We have also been screening people for influenza and flu at the same time. We are very concerned that these people are followed up on, and we also are tracking to see when we have positive cases, and our positive case rate is running about 29%, that people are followed up on and that they have coordinated care following the testing results. The federal government has also designated health centers going forward as the infrastructure for our communities in terms of not only COVID testing, but also antibody testing. Our health center received a significant award this week that will allow us to continue to keep testing people in this community and to also offer antibody testing. Health centers are designated particularly to make sure that vulnerable populations in our community and those at most risk are identified and are treated appropriately. I will now turn it over to Chris McGowan, President of the Chamber.
Thank you, Mary. As Mary said, my name is Chris McGowan. I have the pleasure and privilege of serving as both the President of the Siouxland Chamber of Commerce and the Chamber's sister economic development organization, the Siouxland Initiative. I'm going to take just a moment this afternoon to talk about where the business community has been looking to the Siouxland Chamber as an information resource, where we were when we started planning this, where we are today, and where we think we're going to be in the very near future. First and foremost, When COVID-19 first emerged, the Siouxland Chamber of Commerce recognized that we were going to need to become the central business communication liaison for the Siouxland tri-state community. And so we immediately formed a team within our organization to focus on transmitting information, and we put a heavy priority on making sure that we did two things: that we communicated accurate information and that information was communicated in a very timely fashion. Those were the two tests that we had for everything that we sent out. At this time, we continue to maintain that presence on our website. We will continue to do that. As this crisis emerged, we realized that there were going to be state and federal programs that provided business assistance, private sector assistance. So we became engaged in those programs and served as the primary resource to local businesses who were trying to access those funds from state government, as well as the CARES Act and specifically the Paycheck Protection Program of the federal government. And so working with banks, working with accountants, working with lawyers to make sure that as many Siouxland businesses as possible had the opportunity to access those very important resources. Throughout this time, we also served as one additional communication liaison, working with Rebecca SOCKNAT, working with Kevin GRIEME, working with Colonel Stephanie Samanis on personal protective equipment, providing outreach to the private sector to say, if you have excess inventory or access to PPE, would you please let us know so that we can make sure that it gets into the hands of the frontline healthcare workers? That's been a priority as well. We continue to serve that role. We continue to be a information liaison for the private sector, but we're also now transitioning to helping businesses prepare to reopen. We know that some parts of some states have been allowed to begin retail. We know that other states were never completely closed to retail. But now we're trying to make sure that once again we provide accurate and timely information so that our Siouxland Chamber members, and quite honestly other businesses, we've been a resource to many businesses who are not presently members of the Chamber, but that kind of cooperation is critical in a crisis. I'm going to close with a couple of comments on cooperation. I've been in my role with the Siouxland Chamber and the Siouxland Initiative collectively for 17 years. I've always believed that this was an exceptional community, and the evidence of that is in the response to a tragic plane crash. The evidence of that is in the response to flooding back in 2011. And when we started to see this crisis on the horizon, we made the same prediction that this community would come together, and of course they have. I've seen banks that are usually extremely competitive with one another cooperating, helping, supporting to make sure that all the businesses in the community have access to those resources. We've seen the same thing in healthcare, where entities that aren't typically aligned are now meeting or communicating on a regular and consistent basis. I think that's the essence of Siouxland. That's why so many of us choose to call this home. I couldn't be prouder of my hometown as we continue to fight this invisible enemy. With that, I'd now like to introduce Tyler Brock, who serves as the Deputy Director of Siouxland District Health. Tyler.
Thank you. So yeah, I'm Tyler Brock. I'm the Deputy Director here at Siouxland District Health Department, and I've had, I guess it's been a privilege to kind of be one of the team leaders as far as how we're tackling all these cases and how we're managing contact investigations and how we're trying to communicate to people how best to isolate themselves and keep this virus from spreading any further, and also how we're able to actually release people from isolation. So I just wanted to make a few comments with the 1,500 plus cases that we've had. It has been a big challenge to try to get in touch with all those people. We've developed a team of well over 20 people here at Siouxland District Health Department that have been responsible for trying to get in touch with people and making sure that people know what to do in these cases. And so we're talking to a lot of people that are infected, and we're getting a lot of feedback from them about their symptoms, about some of the challenges that they have with their employment and in their families and things like that. And one of the things that we're seeing is just the wide variety of symptoms symptoms that are going on. Just a range all the way from very severe infections to, you know, people who've been hospitalized, people who we've talked to, and we've had to encourage them to call the ambulance or go to the hospital because their symptoms were so severe while they were talking to us on the phone, all the way from people who are having very, very mild symptoms to no symptoms at all. Really, the range has been all the way from one end, all the way from the next. One of the things, as far as common symptoms that we're seeing, lots and lots of headaches, lots of body aches, muscle aches. You know, when we first started doing this, we talked a lot about fevers. And there's been plenty of people with a fever, don't get me wrong, but there's a significant number of the people that we're talking to that really haven't had a fever. And so, you know, a lot of people do end up with that, but not, especially not early on. But lots of people with headaches, lots of people with body aches. Cough is, of course, very common, but even sore throats and some intestinal symptoms are pretty common as well. So I think what that tells us is that, yes, you know, as we're screening in businesses and as we're screening in places, to be, especially in this environment where we have more and more cases, we have more and more people that are being exposed to cases, especially in the situations where you know you've been around somebody that has this, to be really aggressive with picking up on symptoms. You know, I tell businesses and places that are calling us, you know, what do I do? I've got a person here now that's positive, and what do I do? Do I have to close down? Do I have to do this? And my answer in most of those cases is, yeah, we'll deal with that a little bit, but let's be really aggressive on the front end of this thing, trying to catch sick people from working any longer than we have to. And so I would really encourage people to, again, you get sick and tired of hearing public health people tell you to stay home when you're sick, but I would pay attention to those mild symptoms. And especially in this, I mean, all of us have probably gone to work when we didn't feel well, you know, and those kinds of things. But this is a little bit different time now, and there is a situation, and this is a situation where we need to be a little bit more focused on staying home, even for some of those mild symptoms. Hospitals have told us, you know, the last couple of weeks that people are showing up to the hospital too sick. They should have been here earlier. You know, that people are waiting too long to seek medical care. That people are actually in worse shape than they think they are. So even as we talk about isolation and not leaving your homes with these folks, we want to emphasize that people do need to go outside their homes if they have to seek medical care, okay? When we're telling people to stay at home, we don't mean stay at home no matter what. We mean if you need medical care, please go seek that. Again, we're hearing from too many physicians and things like that folks are staying home for too long. So I wanted to take just one last minute or so just to talk about some of the isolation guidelines and how we release people from isolations and when they can go back to work and things like that. The CDC has changed some of their recommendations. The one thing that always stays the same with this thing is that things change. And so the recommendations that CDC is talking about now, when you are infected, you should be isolating for up to at least 10 days from when your symptoms began. You have to be fever-free for at least 3 days, and the rest of your symptoms really should be pretty much improved, if not completely resolved by that time. We understand that sometimes a cough can linger, and that you know, sometimes your aches and pains might linger a little bit as well, but those symptoms should be markedly improved before releasing people. Household contacts, close contacts need to be isolating for 14 days. And so you might say, well, why do the people who are at home have to stay in for 14 days and the people that actually were positive only have to stay in for 10? That's because it can take up to 14 days before symptoms begin. You can seem perfectly normal for, you know, a week, 10 days, maybe even a little bit longer before symptoms begin. So it is possible that a household contact of a known case, if they're asymptomatic, can actually be in isolation for longer than the case. Doesn't seem quite right, but that's what the information about how we know some of the things that we know about this disease tell us to do. So when we're talking about when can we go back to work, we're getting lots of questions about when to go back to work. We kind of call it we used to call it the 7 and 3, but now we're calling it the 10 and 3. Okay, again, 10 days from the beginning of symptoms, 3 days fever-free, plus the rest of the symptoms, need to be improved, and that is really the basis for what we're recommending. On CDC, they also mention a test-based strategy for returning to work or returning to normal. normal, to where you might have to have negative test results in order to go back to work. That's always an option. In Iowa, we're not recommending that, more or less, mostly because that type of strategy involves more PPE, more testing resources, more personnel to do that, and there can be a few issues with positives kind of lingering for longer periods of time. So we're really encouraging people to use the symptom-based strategy, the time-based strategy when returning to work, and that kind of a thing. So in final, I think I'll turn it back over to Kim Wilson, as she's got a few final comments.
Talk to you later.
Thank you, Tyler. One last thing, we really want to thank our media partners. They have done a really great job working together to make sure that when we hold these types of press conferences that we can do it with very minimal reporters in the room, so that way we can stay true to our no more than 10 people in the room. So we are going to, you'll see me kind of step away, and we'll focus on the interpreter as we ask questions, and as appropriate, the person will come up and answer those. So we will start this afternoon with KCAU.
Hi, so quick question for Siouxland District Health. So as Tyler just mentioned, obviously there are a lot of folks that are coming in with mild symptoms or no symptoms whatsoever, and we're hearing from other folks, who are trying to get testing done through Test Iowa, and because maybe they're not lining up with all these more major symptoms, that they are not qualified to get that kind of a test. What would you say to folks who are in that category, who have tried to get a test, maybe even multiple times, and have been unable to do so, but they still might be concerned about those symptoms?
Yeah, I guess what I would say about that, if for some reason you have a little bit of trouble getting into Test Iowa, we have more than adequate testing access here in Woodbury County, here in Siouxland, whether it be through the Siouxland Community Health Center's drive-through testing, whether it's through Mercy One out at Singing Hills. There are many places where people can get tested, and usually it's just a simple phone call to your doctor. The doctor will talk to you a little bit about what you're experiencing. We'll call in an order for those tests, and it's a matter of getting it done. There's very, very little reason why anybody, especially anybody with symptoms, should be struggling to get a test.
And Tyler,
Go ahead.
I just also wanted to mention that there are many people in our community who do not have a primary care physician. So if there is a person that is concerned that they don't have a primary care physician, can't get an order, we will see you at the Siouxland Community Health Center. If you come to our main entry, we will make sure that you are given a telehealth visit with the provider, who will then arrange testing for you the very same day.
Just a housekeeping note from reporters. Can I please make sure that your lines are muted? KCAU, do you have any more questions? Okay, KTIV.
Hi, yeah, so for tests that have been reported, are these all Woodbury County residents, or are they from people outside the county as well?
As far as the numbers that Siouxland District Health tracks, those are all only for Woodbury County residents. So that would be just the 102,000 residents of Woodbury County that we track numbers for, not for the greater Siouxland area.
Okay. And then with the WIT testing center open, the Test Iowa, has that impacted your guys' numbers, or are you seeing less people now that that one's open?
No, Mary KAPTAIN-DAHLEN is shaking her head no. They're still operating at full capacity with their testing center. Is what it would be, and we're not. We don't necessarily get the numbers of reports that Test Iowa has done, so we're not sure what volume. But also remember, Test Iowa, that is an area that they're attracting across western Iowa too, a much broader region than just the tri-state area that predominantly our testing's coming from.
Absolutely. And so have you guys at all seen an increase in numbers, positive cases in the long-term care centers / assisted care centers here in Woodbury County?
Thankfully, no. Thankfully, no. We've been fortunate. Other places around the state, of course, cases in long-term care centers have been a major driver of case counts and fatalities in Iowa and across the United States. Fortunately, we have not seen an increase in residents in these kind of centers.
All right, thank you.
KTIV, any other questions?
No, I'm good. Thank you very much.
Meg, KPTH.
Yes, can you talk a little bit more about the antibody testing that you mentioned? Are you going to need a referral for that? Or can people just contact you if they're interested?
The Community Health Center currently does have the capability to do antibody testing. We are at the present time doing our model validation, and we are doing that with our internal staff. We will make an announcement to the public when we are ready to offer that test to the community.
Okay. And my other question is, do you agree with Governor Kim Reynolds' decision to reopen certain businesses? Do you think Woodbury County is ready to reopen additional businesses next Friday?
This is Chris McGowan with the Siouxland Chamber of Commerce and the Siouxland Initiative, and every decision that's made about reopening is working very, very hard to balance protecting lives and protecting livelihoods. And I'm not part of those discussions with those key decision makers. I've certainly been someone who's been contacted to ask for how our businesses are faring in this crisis. And the truth of the matter is, some are faring well, some are doing okay, and there are a fair number who are struggling. And so I know that those decisions are based on trying to make sure that we're acting in a safe and prudent and responsible manner, but also trying to recognize that there has been an economic toll that we probably have not seen in over 100 years, and that crisis demands their attention as well. So it's a very delicate balancing act.
Okay, thank you.
Do you have any more questions?
No more questions.
Mason, do you have questions from the Sioux City Journal?
Yeah, I have one. I have a couple. This is Dave Greason.
Okay, Dave, go ahead.
Mason, I'll handle. As you probably have seen, you know, in addition to 116 new cases reported today, in Woodbury, there's a record 361 in neighboring Dakota. So it's nearly 500 in one day. And I guess it's not a coincidence. I would guess it's probably not a coincidence that comes on the heels of completing the testing of all the remaining workers at Tyson and Dakota City that had not previously been tested. So I find it curious that the word Tyson continues to not be mentioned by anyone in public health or either on the state level or the county level. And we seem to be the only community in Iowa with a large Tyson plant where that isn't being addressed. So I guess my question is to Kevin or Tyler or whoever would like to address it. Can you, I guess I'll ask again, can you talk about the rate that we've seen, and particularly in the last couple of weeks, and related to that plant and the community spread?
Okay, Dave, I think in your own words, what I have to do is I have to sidestep giving a specific answer, and that's related to Iowa code and compliance with the privacy. And since you are talking about potentially a business or industry that's not within the state of Iowa, that is something that needs to be addressed by the state where that plant is. And so that isn't anything that I can actually answer at this point in time.
Well, I know you've cited that before, Kevin, and you talked about it's outside the jurisdiction of Woodbury County, but if that was the case, you couldn't talk about comparisons to the county or to other counties in the state, or even what's going on nationally. So, what law is preventing you from talking about a facility in a different state?
It is actually that's really outside of our jurisdiction and territory. That's not what that would have to come out of the other state. That's just a standard of practice that we do.
Okay. Can you talk about meat packing in general, about how that might be affecting the spread and the number of cases we have?
Meat packing in general, as far as within the, there probably isn't anything that I could really state that's based upon any specific information. If you're referring to the report that came out of, I reached out to Blackhawk County because I know there was some allusion to that sort of a press release that went out there. I've reached out there to their public health director, attempting to find out just what data source and how did they actually determine that number that they actually released. But that was, once again, an Iowa business within the county. And so that plays different parameters than what we're able to follow here within the tri-state area.
Okay. Mason, did you have a question?
Okay.
Sheila Brummer.
Thank you.
You bet.
Thank you. Sheila Brummer from KWIT KWIT is asking, will the health department release any potential contact locations in the county, or is this still a privacy issue?
For the most part, it's unnecessary. Okay, in a lot of cases, it's unnecessary. It's not. Sometimes it's a privacy issue when we're talking about specific locations that are involved in outbreaks and things like that. Iowa law, we've gone over that many times. As far as locations in, if there's outbreaks and it warrants a public declaration, that comes from the state epidemiologist, the state director of health. They're the ones that can determine when it is okay for us to announce the names of a business or individuals that may be involved in an outbreak. But again, in most cases, particular locations, and this has been a question ever since the very beginning, where are people shopping, where are people working, and those kinds of things. For the most part, the main point of trying to stop the spread is to get to the people that are involved, find out who they've been in contact with, make sure that the cases are isolating, make sure that the people that they've been in close contact with are isolating. There's a lot of things going on with. We have a lot more latitude to at least to contact employers in certain industries that's been allowed to us, as part of public health and for the purposes of public health investigations. That's not always allowed under more routine circumstances. So we are able to, when we find out that a person works at a particular location, we are able to call that employer to make sure that they are aware one of your employees is positive, to make sure that we're ensuring compliance. So there's lots of things that we're doing to communicate with the specific locations, but as far as whether or not we can talk about those things publicly, that really is a decision that gets made at the state level.
Woody Gottberg, KSTJ Radio.
Well, what I'd like to know is how much cooperation and communication is going on between you and Dakota County Health and Union County Health. We constantly hear about what a great tri-state region this is, and I don't understand why there can't be better communication between the three states as far as pinning down a specific location. I mean, to me, it's unconscionable that if there was a mouse found in a restaurant and that place closes down and everyone knows who it is right away, that we can't have the public made aware that there's a particular location or locations where we have issues. So how much communication is going on between the three county public health agencies? Because I never hear of any information or note comparison going on to provide this truly metro tri-state totals.
One of the differences, Woody, that I need to point out is that South Dakota has a state-run system, so they do not necessarily have that local presence like we see in Nebraska and the state of Iowa. So it's a little different system within that. We have requested and we have held tri-state teleconferences addressing some of the areas and the issues that we're actually facing. And as we've been fortunate enough that with Dakota County Public Health, as we've had need to reach out to connect, to assure that we both have the information that we need, troubleshoot some of the things that we've experienced in some of the reporting. I think those are all key things that we've actually done. And for example, with one of those is there has been some of the testing that has been done at some of their public places in the Nebraska side, and it's been a real challenge sometimes, even if they're Iowa residents, getting those testing results. And so we have tried to work with them, and we've tried to work with the Nebraska system. We're constantly doing it, and we do end up in those scenarios where we need the if it's a positive from Woodbury County, we need to have that data and that information so we can do what we're required to do as far as follow-up with those. So we do work with Dakota County Public Health, communication as necessary. We have reached out, and I said engage South Dakota State Public Health in some situations, but I said that's a cooperation that we're doing behind the scenes to attempt to get the public health work done that we need to get done.
So are they giving you any information from South Dakota or Dakota County as far as any other places you should be concerned about? I'm assuming since Seaboard Triumph releases their figures to any media that calls on whatever day we call without a problem, and they were around 30 to 40 cases last time I talked to them, I don't understand why there wouldn't be concern if there was another business that was reluctant to go public without, when, you know, we have 116 new cases today. Well, where did they come from? Is there a specific location we should be concerned with?
At this point, the 116 cases, we're just starting in those contact investigation follow-ups. We don't always have the direct source, and it comes from across all the testing that's being done. So it could be through any of the community testing site, any of those types of things. That's coming from a variety of places. And as far as the businesses on the Iowa side, we work with them and if we would ever find those situations, and it is really their decision as a business to make what information they want to release. And so we just work with them to make sure that they're, if it should happen and occur, that they're doing the follow-up for education of their other employees to protect themselves, because they're just as interested as we are as a business in limiting the spread and impact on them as an organization.
All right, well, let me shift gears to a topic that I don't think's been brought up publicly before. Several people, including a member of city government, have said to me that they thought it was possible that from late December into February, we could have had a number of people actually get sick with COVID through here and not even know it, because nobody knew what that was at the time. And I don't know if antibody testing would help prove that or not. Has there been any credence or evidence that we had a run like this go through Siouxland in the winter months from, say, Christmas and early February?
That has been a speculation that's passed around since the onset of this. There may be some relevance with some of the antibody testing that's beginning that may show some limited as far as they had contracted and recovered from it. We don't, at that point in time, since we weren't testing, we can't confirm if it was COVID-19-like, if it was actually COVID-19-like, if it was influenza that mimicked it, we're not sure. But those are things that we don't, right now, if we went back in time and knew that was a question that we had to answer now, we would have tried to figure out, is there a way to get testing done, which simply wasn't being done at that point in time. So there's potential. We can't deny it, but I think it's really on speculation, and we don't have the science that says, yes, it was present and out there.
All right, thanks, Kevin. I appreciate the work you're doing in the position you're in.
You bet. Thank you, Woody.
Woody, do you have any follow-up questions?
I'm good.
Katie Pikus, Iowa Public Radio.
Hi, thank you all for giving this question for Rebecca SOCKNAT. I know that the county got 3 ventilators from for Mercy One from Johnson County this week. Has the county put in any other requests with other counties for ventilators, and where else is additional equipment coming from?
So, like I had previously mentioned, we are working with agencies throughout the county to put in weekly requests for personal protective equipment, and those requests go directly to the state, which is Homeland Security and Emergency Management, and Iowa Department of Public Health, sitting at the State Emergency Operations Center. As other needs arise, just like you mentioned, with a need for an additional ventilator or different parts needed in this response, those agencies go through emergency management. We either reach out through the regional medical coordination centers, we reach out to other counties, and we also reach out via, like Chris had said, through the chamber to see if we could get them locally. We have a variety of different avenues we try to fulfill these requests from the agencies, so again, they can continue to provide the great work that they do.
So why did it come from, the complete other side of the state rather than somewhere else, rather than another county nearby or within the RMCC region? It looks like there's around 54 available ventilators in the whole region. So how short is the county and the region as a whole?
Honestly, those numbers being reported for ventilators doesn't really constitute whether an area is short or not. The condition of the patient dictates what type of ventilator is needed, and those decisions are made at the hospitals and by their physicians. So again, as the agency is requesting, we get as much detailed information as we can get to ensure they're getting the equipment they need to care for individuals.
Okay, thank you.
Any other media follow-up questions? Okay, thank you all very much. And we appreciate, again, I just want to say thank you so much to Siouxland District Health, to Siouxland Community Health, and to the Siouxland Chamber for their partnership. And again, thank you to the media.
Again, we've been listening in a live press briefing this afternoon from Siouxland District Health, just wrapping up. A couple of high points from today's session. 113 new positive cases here in Woodbury County, and we previously had been alerted to 361 in Dakota County, Nebraska. That gives us a total of more than 470 here in the immediate metro just today. When it comes to testing, again, testing continues to increase. Locally, the Siouxland Community Health Department ranking number 4 out of the top 20 largest testing sites in the state of Iowa. Kevin GRIEME, the director at Siouxland District Health, saying that 1 in every 26 Woodbury County residents have been tested, and that compares to 1 of every 52 inside the state of Iowa. At that drive-through testing site conducted by Siouxland Community Health, we're told today that roughly 4,800 screenings have taken place. 29% of those being tested have reported positive results. And lastly, from today's session, the community health workers, again, unable to provide any information concerning the identity of a particular source of these positive cases. Again, they've been unable to pinpoint, at least publicly, where those outbreaks are occurring. We'll have complete wrap-up of today's session, plus the rest of today's news. That's upcoming at 5, 6, and 10 tonight. We hope you'll join us then. In the meantime, I'm Tim Seaman for KCAU 9 News.